and welcome to the Swoosh English podcast. My name's Scott.
And my name is Ina.
And today we're going to go through our method and overview of the OET speaking examination.
Yeah, we're going to get into the speaking tasks, those role plays, go through an overview exactly of what you have to do, go through the scoring criteria, and then just generally talk about what you should do and how things should proceed on the day of your exam.
Yeah, so lots of interesting information that you can take away from this podcast today for OET speaking, because no doubt you probably have a lot of questions to do, you have a lot of queries, you've got a lot of worries about it, given that it's a very different role play to what you may have done previously in your English studies. So let's get into it. So let's start talking about what the role play is in terms of the speaking section.
Formats.
So the speaking section will last 20 minutes in total. So in that time, you have 2 role plays to complete. You have 3 minutes to plan for each role play and then 5 minutes to execute each role play. Also, before the role plays begin, you will have a brief unassessed section where the examiner will simply ask you some questions about your healthcare profession and obviously what you want to do with it.
Yeah, so that will last about 2 minutes,
That will last 2 minutes.
Yeah, about 2 minutes. And that really serves as time for you to warm up, you know?
Yes.
Start talking in English, really warm up those vocal cords, make you feel comfortable, get to know your interlocutor. And also really, you should pay attention to your interlocutor's accent during that time. You know, really try to listen in on how they speak, really get used to how they speak and their accent so that then you'll be familiar with them as you're going through your role plays, of course, during the assess time of your speaking.
And as we know, it's all about feeling comfortable on the day as well. Yeah. So that's a way for you just simply, as Una said, get used to the interlocutor's accent. They get used to your accent, pick up some speaking speeds, get into a nice rhythm, feel comfortable, and also just feeling relaxed as well. Hopefully the interlocutor will make you feel easy and ready to go for the assess part. Yeah, of course.
And you want to go in, you know, greet your interlocutor nicely and just overall seem like a confident person and set a good tone for how your speaking is going to continue. And try to speak a lot during that time as well. You know, get lots of speaking in so that you can really, get used to speaking in English.
But of course, that comes secondary to the actual assess part, which is your 5-minute speaking role play. So the role plays themselves are actually designed to replicate real life medical situations in which you are obviously trying to comfort a patient in regards to some sort of medical issue they have. So regardless if you're a doctor, you're a nurse, you are a physiotherapist, you are a pharmacist, etc., you are going to be giving some advice to a patient. So you might have to console them, you might have to make them feel less angry, you might have to make them feel more comfortable, or even just reassure them as well.
Yeah.
So that's what's different about OET, in that obviously language skills are very important for this and how you use language, but also you're being assessed on your communication skills in a given medical context as well. So that's why the criteria that we're going to go into now as well reflects upon both sets of those sets of criteria. Your linguistic skills as well as your communication criteria.
Yeah, definitely. And we'll get into that. But that's just a good point. You know, although this is not a reality, like this situation is not reality.
Oh, yeah, of course.
It is simulating realistic experiences, which of course our doctors and nurses and medical professionals may have experienced in their own workplace, in their own daily life, in their own language, and now they have to do it in English. So try and, you're going to be drawing upon your work experience as well.
Precisely.
Very much so in relation to this conversation.
You can use that when moving forward as well. Hopefully you've gone through similar experiences before. Just do what you've done in your previous experience in terms of your communication, as well as obviously your experience that you picked up training for OET as well, to just basically do as well on this role play as possible.
Yeah, definitely. And you have to show your language and communication skills. So let's get into that now then, Scott, shall we?
Let's get into the criteria. Okay. So you are assessed on 9 different criterions. 4 are for linguistic criteria and 5 are for your communication skills criteria. So for the communication criteria, you are scored from 0 to 3 for these.
0 to 3
So the
each.
communication criteria are the following. We have your relationship building. So how good are you at establishing rapport and conversation with the patient?
So it's referring to the opening of your conversation, how you open the conversation, and the empathy that you display throughout that conversation with the patient.
Precisely.
And the language that you use in order to convey your empathy. Yeah.
Then we have your understanding and incorporating. Basically, how good are you at listening to your patient and providing them comfort throughout it as well? So once again, drawing on your ability to empathize with the patient.
And how fully you involve that patient in the conversation.
Very good.
Very Very good.
Then we have providing structure. So how well simply are you at organizing your thoughts and your process of making this patient feel good and providing care for them? Obviously, do you start with a greeting? Do you ask them relevant questions? Do you then offer suggestions for treatment and then give them a diagnosis before giving them the options for them to live?
Very good.
Simply.
And how you introduce new topics. You know, how you really, as you say, structure your conversation to make it easy, have a good impact on your patient. Yeah. And then we have our information gathering. So then what kind of questions do you ask in order to gather the information that you need to respond to the patient?
Not only are your questions appropriate, but also more importantly, are they open as well, taking into account the many different aspects that the patient wants to answer with, which is important.
Definitely. And then, of course, when you have information gathering,
you have information giving as well. So not only, of course, are you asking the appropriate questions, listening to the responses, but then giving the appropriate information to diagnose and treat the ailment which the patient has come from.
Yeah, the impact of how you provide that information on your patient is very important there, and overall make them comfortable and understanding of the information you are giving to them.
So the clinical communication criteria, as you've seen by how we've outlined it, this should pretty much follow what you've been doing in your own healthcare profession before you've come. Now let's go on to the linguistic criteria, which are assessed on a different scale of 0 to 6 points for each of these. This is basically your ability to use your English language skills.
Yes, and there are 4 of those linguistic criteria. Okay, so the first is intelligibility. So that's really referring to your pronunciation, your accent, and your intonation. So how well you can be understood by, of course, your interlocutor, who is, of course, acting as the patient. Yeah, so think of it all. How can you say the sounds of the English language? Do you struggle with any sounds? Is that affecting your overall pronunciation? What kind of an impact does your accent have on your English speaking? What kind of impact does your first language have on your English speaking and the sounds that you make in that? Are you able to be understood?
Precisely.
And your intonation. So that's referring to the rise and fall of your voice. You know, do you speak in that robotic tone, or are you speaking nice, going up and down, stressing the correct words
and of course,
syllables?
Changing your tone is highly essential for your effective communication. So we know that.
Exactly.
Then we have your fluency, which of course is standard across many English language examinations. Basically, how smooth can you speak, how constant can you speak, and how much can you speak without having any unnecessary repetition, breakdowns, false starts, hesitations, in which communication may break down overall. So you want to make sure that you're speaking in a nice, consistent pace throughout.
Definitely, yeah. Okay, and then we have also the speed. Did you refer to the speed as well?
Nice and consistent.
Yeah, making sure that your pace is quite a natural pace, smooth and flowing. And just generally, how easy is it for the listener to understand you and sort of enjoy how you speak? And then we go to appropriateness of language. So that is, of course, referring to the language, the tone, and professionalism of your listener's understanding.
Yeah, so are you sounding like a doctor? Are you sounding like a nurse? Are you sounding like a pharmacist? So obviously you don't want to be overtly formal, like you're obviously doing some sort of academic speech. That's not how
or like you're speaking to another doctor.
Or like you're speaking to another doctor as well. You don't want to be super informal as well, where you're using lots of colloquialisms, contractions as well. You want to be somewhere in the middle, an appropriate way where you're equally professional, but also trying to instill support, understanding, and empathy for your listener.
Very good. Okay, and then the last one, of course, is your resources of grammar and expression. So the impact of your grammatical accuracy and your word choice on your listener's understanding. So, are you using correct grammar? How many errors do you make throughout your speech? Is that affecting the meaning of what you are saying? Is your word choice correct? Is that affecting the meaning of what you're saying? How well can your listener understand you?
Yeah, precisely.
Very good. So those are our criteria then for your speaking exam. So there is a lot to consider, and it's really important before you go into your exam, of course, and that you get lots of practice and that you really understand the criteria. That you really understand what it is you are being marked on, because that way you can improve upon any weaknesses that you may have and look at each of these criteria in detail and make sure that you are getting the score that you need.
And of course, listening to these criteria in the podcast today will simply only be an overview for you, but we recommend that you really understand this criteria so that, as Una said, you can understand exactly what you're being scored on, find out your weaknesses, also find out your strengths as well, and then see that you're consistently improving.
Exactly. And you can find this criteria criteria on the OET website.
On the OET website, yeah, very easy to find.
And it's easy to access, so make sure that, I would almost say, stick that on the wall, like make that your go-to, you know the criteria, you know what you're being assessed on, what you need to improve upon.
All right, so that's the criteria done.